Hand hygiene and surface cleaning are recognised as the most important activities for an effective infection prevention and control program. There are three basic principles for infection prevention: effective surface cleaning and disinfection, good hand hygiene, and infection prevention education and training. Each year in Australia, approximately 200,000 patients suffer from a healthcare-associated infection. This increases the length of hospital stays, the complexity of treatment and care, and is costing the Australian healthcare system billions of dollars per annum.
What you touch can enable multi-drug resistant bacteria to climb onto your fingers without you even knowing that they are present. Once they are on your fingers, they can jump off again onto a patient or a frequently touched surface or a reusable medical device or even your own skin. In our collaborative research programs, we have already proven that multi-drug resistant bacteria live in biofilms on surfaces. These bugs can transfer onto bare hands or gloved hands and be present for up to 20 subsequent touches. This is how microorganisms spread within healthcare settings. So, hand hygiene and surface hygiene are connected. Both are critical. Both require interventions that remove and destroy pathogenic microorganisms.
Whiteley Medical's TGA-registered products can assist in reducing the spread of germs in healthcare facilities. For further information on our infection prevention products, please visit Whiteley Medical's website.